For my project, I did the elderly community 60 and over in New Lennox, Illinois. Services providers for the elderly in this community. Trinity Services is one. It's a nonprofit organization. They take SSI for dual diagnoses. They also take PUN funding, Medicare and Medicaid. They provide day programs for individuals who have IQs less than 70. They provide a Silas home. They provide housing and work programs, transportation to jobs, doctors. You have to be 60 and over. In the community right now, they have 40 people who are 60 and over who live at Trinity Services and work there. The barriers, you have to be disabled and receive their services, and you have to have an IQ less than 70. Another service provider in the community is Silver Cross Hospital. They're a nonprofit organization. They offer seniors classes, programs to enhance wellness and independence for 60 and over. Free Senior Advantage Day is every single year on November 18th. They offer free health screening, free Medicare education, free flu shots and exams. The barrier is that there's no transportation. It's only one time a year, and there's a lack of knowledge of services in the community. Many seniors don't know about their services. Another service provider is the public library. They're a nonprofit. The library will deliver books to seniors in the township who cannot drive and get to the library. All they have to do is reserve a book online or call. They have technology help, such as classes for seniors who don't have good eyesight. You need to make an appointment. They'll help you, such as sewing classes, learning how to edit phones, cell phone classes, transferring VHS to disc. The barriers for the library are transportation, and you have to be a resident in the community to receive services. Another service provider is called the Medical Exchange Service. They're a nonprofit. They offer seniors medical supplies such as commodes, wheelchairs, walkers, canes, crutches, etc. The barrier is that you have to be a resident and you have to come and pick up the equipment. Peace Lutheran Church is another service provider. They're nonprofit. They offer seniors with coordinating food for the need from food pantries. They provide seniors with flu shots, quilts for seniors, prayer shawls. They have a group called the Trailblazers, which is a senior group for seniors to get together to eat and have companionship. The pastor delivers the sacrament to those who can't attend services. The gaps is that there are more churches in the area that need to provide seniors with services. This is the only church that I know of that does that. I called all of them. Biases is that it's my own personal church, and the barrier is that there needs to be transportation and the lack of knowledge of service in the community. Another service provider is the food pantry. They're nonprofit, must be a resident, must show ID and a utility bill. They're Monday through Friday from 9:30 to 11:30, and then there's a gap in time, and then they have services from 1:30 to 3:30. The barrier transportation time is transportation, the time frame, and that you have to be a resident in the community. Another service is Meals on Wheels. They're nonprofit. They provide home delivery meals. You have to be eligible. You have to have low socioeconomic status. You have to register by phone. There's a waiting list. New Lennox providers right now is 40 people. They serve 1,000 people in the Will County area. They also have nutrition education. You have to be 60 and over. They have a Get Out of the House program. It is Monday through Friday from 11 a.m. to noon, and you have to make a reservation in order to eat meals with other seniors. The barriers are that you have to have a low economic status in order to receive services, and you have to register, and there's a waiting list. Another provider is the assisted living. It's called the Cottages of New Lennox. It's the only assisted living in the whole entire town, which is a huge gap since there's 448 seniors who are over 60 years old who live in New Lennox. You have to be pretty much independent. They only take private pay and long-term insurance. They offer meals. There is a waiting list to get in. You have to be 62 or older to apply. They do offer transportation to outings and stores. The barrier is that you pretty much have to be independent to live there, and there's a waiting list, and they take private pay. The last service I have is transportation services. The New Lennox Township offers transportation services for seniors. It's a nonprofit. It's paid through the taxes of the residents of the community. But this service only takes you to a medical appointment and therapy appointments only. It's Monday through Friday from 7 to 4:30. They need 24-hour notice. And as of January of 2020, they started charging seniors $3 each way. There's no long-term nursing facility in New Lennox, and that is the biggest gap in the community. In the know, there's 448 seniors in New Lennox over 60 years old. 78% are female. 413 of these seniors are still working. 22% of them live alone. 20% live on food stamps, and 7% live below the poverty line. Duplicate services for my community are Peace Lutheran Church and the Food Pantry. Both provide food from food pantries. Meals on Wheels and the Cottages of New Lennox, the assisted living, both provide Meals on Wheels meals. The Cottages of New Lennox, the transportation service, and Trinity Services all provide transportation services, although they provide them for different areas in the community. Silver Cross Hospital and Medical Exchange Services all provide seniors with medical services. Transportation is the major challenge for the seniors in New Lennox Township. The elderly community also needs to face the obstacle of socioeconomic status, low income. Most of the time, seniors are on fixed incomes and have no transportation available to them to economic places such as gas prices, maintenance on vehicles, medical and age stipulations. Paying for transportation on a fixed income is not feasible for many seniors. So my evidence-based practice, most agencies in New Lennox do not offer transportation for seniors. The agencies that do offer transportation have restrictions such as residential restrictions that hinder some seniors. New Lennox Township needs to improve the transportation services it provides for seniors who live in the community, and according to the Transportation of America, the challenge a community faces is meeting the needs of older adults. The local government ranked transportation as the second highest issue for seniors after financial issues. So my proposal would be to ask the state of Illinois and the Township of New Lennox for funding to support transportation for seniors. If the community can provide reliable transportation for seniors in the community, it will keep families together, provide independence for seniors, solve seniors facing isolation, provide quality of life, and help seniors reduce economic hardships. Solving this barrier can provide the organizations in New Lennox to provide essential needs for seniors while enhancing the seniors' lives in the process. To implement the transportation plan for the seniors in New Lennox, there needs to be a meeting in the New Lennox Township and the senior agencies in the community. The meeting would discuss benefit of having transportation for seniors in the community. Funding schedules and planning would be discussed to implement the senior transportation plan to be successful. The transportation plan for seniors of the community of New Lennox will use case management skills to meet the seniors' needs while implementing the community's achievements. Developing the senior transportation plan will provide independence for seniors who live in the community who once wouldn't have had before. The program wouldn't be restrictive to any individual, including age, race, religion, physical, mental capabilities, or socioeconomic statuses. The program will strengthen family ties in the community, provide independence for seniors, provide quality of life, improve data on seniors keeping doctor's appointments. This program will enhance social justice and human rights for the elderly community, allowing them access to organizations and agencies with no limitations. It is important to get the communities involved, as well as the seniors, while providing open communication and collaboration between the two. The proposed plan will address the common barrier, which is transportation for seniors in the New Lennox Township. Thank you.